You have a pretty unique perspective for
Yeah,
a lot of our members as a background as a physician.
Right.
So I wanted to get your thoughts on why Obamacare has been failing patients and how the law has kind of changed the healthcare spectrum.
Well, I mean, how it's changed the healthcare spectrum is it's had a big expansion of the Medicaid program, the traditional Medicaid program, which we know was financially strapped and didn't increase access to patients to get physicians before it was expanded, because the reimbursement level was so low that not a lot of doctors take Medicaid in some areas. So expanding the Medicaid program, the traditional Medicaid program, it's not a good way to help insure people that didn't have insurance, because they still don't have access, and that's been borne out in the data. They still are relegated to go to the emergency room, and it's just not been that helpful. And the other thing is it's financially strapping the states already. So this is a program that is going to continue to not provide good insurance, cost to the federal government and the states an exorbitant amount of money, which is not being well spent and really doesn't help the patients get access to health care. And then on the exchanges, what we've seen is those are spiraling downward, out of control. Insurance companies are dropping out. Recently, a CEO of one of the largest insurance companies in the country said it's on a death spiral. And the reason is because it's resulted in massive increases in deductibles for patients. What that means is that if you go to the doctor or you're in the hospital, your upfront out-of-pocket costs are very high. Before the Affordable Care Act, most people had deductibles somewhere in the $1,000 to $2,000 range. We're seeing individual deductibles of as high as $6,000, $8,000, and families, so $10,000 or $12,000 they have to pay up front. So I would argue that's not insurance, because most people can't afford that. And then the monthly premiums are continuing to skyrocket and are rising at double and triple digits across the country. So it's going to continue to limit access. In fact, about a third of the counties in our country only have one option. So the Affordable Care Act was supposed to give us options. It's actually limiting options. In fact, there are 5 whole states where there's only one insurance option on the exchange. And then the worst part is the approximately 170 million people that still get their insurance through their employer are seeing their costs dramatically increase because of the losses that the insurance companies are experiencing in the exchanges. So it's just a snowball rolling down a hill in the wrong direction, and it's really affecting patients. And that's the important point, right? The important point that I bring as a physician to Congress is that whatever we do, we need to see how that affects people. And Washington, D.C. wants to talk about money and finances a lot when it comes to health care, but people like myself really try to refocus that on how it affects families and individuals. And the Affordable Care Act has not had a positive influence on most people.
Now, you introduced a measure that's aimed at tackling what many consider to be one of the biggest flaws with Obamacare, with the new law. Can you get a little bit into what that problem is and what your bill does to fix it?
Yeah, first of all, the Affordable Care Act tried to put in what I would call non-actuarially sound principles. What that means is, insurance companies have decades of data on how to assess risk of the populations that they're insuring. And one of the things, the age rating, is something that has had a dramatic effect in a negative way, and that's what my bill does. My bill tries to address that. Before the Affordable Care Act, we had data to show that the cost of health care for people who are older, say pre-Medicare, age 64, versus younger people like age 21, it was about 5 times more costly for their insurance coverage because they used 5 times more health care, the older, sicker patients. And so what Obamacare did, it artificially set what's called the age rating at 3 to 1. And what has that done? Well, it hasn't decreased the cost dramatically for older, sicker patients. It's dramatically increased the cost for younger, healthier patients. Because when you limit what the insurance companies can do as they assess the risk of the patient population, and you artificially set that at something that is not true, what has happened is we're driving younger, healthier patients out of the marketplace because the costs for everyone have gone up. And that it's pretty predictable that would happen. So what I try to do in my bill is give the states the flexibility individually to have these age bands or age ratings set by the insurance industry in their state and done in an actuarially sound way. And what that will do is that will actually help, I think, drive down costs for everyone, because we'll get younger, healthier people signing up for health insurance, which of course helps with the risk pool because they're relatively low risk for requiring health care coverage.
Now, a big focus in the debate thus far has played on worries about scrapping the law entirely, and there are some provisions that have been very popular,
That's true,
such
yes.
as allowing pre-existing
Right.
conditions. Can you kind of speak to what you and Republicans in the House are doing to make sure that we're not just dropping everyone off of health care?
Yeah, there's a couple of things. First of all, as a physician, look, I had patients who had pre-existing conditions who worked their whole life and couldn't get health coverage. I had an employee whose spouse went past her lifetime cap because she ended up having heart problems and needed a heart transplant. Her lifetime cap on her insurance and had to go on Medicaid. For your viewers, what that means is most health insurance coverage before the Affordable Care Act, you capped out at $1 million in your lifetime, and once you spent that, you didn't have health insurance. Look, Republicans agreed with these changes in these policies before the Affordable Care Act. We didn't need to have this massive government program to address, for example, the lifetime caps, the pre-existing conditions, and other things that are very popular. Young people getting just off the ground with their families, up to age 26. We agreed beforehand that that we should help cover them, allow them to stay on their parents' insurance as long as it's reasonably priced and properly done. So these are the type of things that we agreed with before, and we're going to maintain. And currently the pre-existing condition situation, I think, is better addressed versus federal mandates by trying to help the insurance companies cover them with high-risk pools, because we know that people that have a lot of pre-existing conditions cost the healthcare industry a lot of money because they utilize the system. In fact, it's so dramatic, the cost, is that it drives up the cost for everyone else. So if you cover them through state and federally supported high-risk pools to keep their costs down, it actually drives down the cost for everyone. And some of these other provisions that will be maintained, look, Republicans agreed with these things before. We didn't need to have the federal government step in and in a dramatic way like the Affordable Care Act to address some of these real problems that we knew about.